The increasing rates of suicides, depression, and burnout among physicians emphasizes the importance of creating a wellness culture within graduate medical education programs. Physician burnout is a long term stress reaction characterized by depersonalization, cynical or negative attitudes toward patients, emotional exhaustion, feelings of decreased personal achievement, and a lack of empathy for patients. Physicians who are mentally and emotionally detached from their work are unlikely to provide quality care or positive patient physician interaction. To ensure a healthy physician workforce, prioritizing wellness is a necessity and requires concerted efforts by both the individual and the training program's leadership. For this purpose, a peer managed internal medicine resident wellness committee was created. The initial objective was to provide confident assessment of stress, depression, and other related mental health issues in order to make personalized referrals to local mental health clinicians and other community resources. Further objectives included incorporating signs and symptoms of burnout as well as management strategies into the didactic education, providing assistance and support to help transition senior medical students into internship, and organizing social events to encourage personal wellness for residents and their families. We also work to enable collaboration in planning future wellness activities in hopes of building interdepartmental relationships between residency programs. In October 2018, 5 50-minute didactic sessions on various wellness and burnout topics were provided for internal medicine intern and upper-level residents. The goal of this project was to openly discuss both burnout and wellness and include individual strategies for reducing stress. Each session discussed the concept of burnout and wellness differently with the intention of giving residents unique individual tools to incorporate in achieving wellness. Through cooperation with the UAMS Psychiatry Department, 4 different resident wellness task force members led these sessions. The first session was a lecture on the Stoic philosophy and its application to wellness. The second session was an interactive mind mapping of causes for burnout, wellness, and happiness. The third session included a lecture on the background of mindfulness meditation as well as demonstrations of practices of mindfulness. The fourth session was focused on gratitude and included interactive exercises and concluded with a brief relaxation exercise. The final session was a focus group where residents were asked to brainstorm contributions to their burnout and possible ways to intervene. At the end of each session, a post-didactic evaluation was filled out by resident participants. The most highly rated sessions were those that included relaxation activities, especially mindfulness and meditation. The main drivers for burnout include workload, duty hour violations, and minimal clinic or leadership support at the VA and MICI rotations. Additionally, curriculum challenges on top of clinical workload include conferences, learning modules, computer system training for different hospitals, research, and quality improvement projects. The majority of residents were optimistic for improvement and provided suggestions for change. Wellness topics, including mindfulness and relaxation techniques, were asked to be added to the yearly didactic schedule, as well as being available throughout the year and after stressful rotations. Residents suggested a mentor system with interns and upper levels to form support teams to help cope with stressors. Through the suggestions of fellow residents, we were able to incorporate an upper-level mentor program for incoming interns and put together wellness packets to give to upcoming interns that included handouts on financial wellness, how to establish care with primary health care providers in the community, a handout on house staff favorites, which listed our favorite local restaurants, parks, gyms, and other insider information. A monthly wellness newsletter was created to advertise upcoming conferences, social activities, local festivals, and resident birthdays. By approaching the physician's burnout from a peer and individual perspective instead of an administrative approach, we achieved our primary outcome of creating a culture of wellness within our program and changing the stigma regarding mental health.